Hi, this is Dr. Nick, and I'm the Incrementalist. Today we're talking about blood pressure screening and how you go about that and why it's important. So in the world today, there's about 84 million people suffering from cardiovascular disease, and we know that hypertension, or high blood pressure, is the leading cause of cardiovascular disease and strokes. So if we can prevent or treat hypertension, that's good news all around. So here in the United States, we have about 2,200 people dying from cardiovascular disease per day. So in the last 40 seconds that you've been listening to me, one person died as a result of that. So what can we do about it? Well, the good news is we can screen for hypertension. It's a relatively easy process to go about it. How do you do it? Well, we have to measure the blood pressure, and the process of doing that is to use a sphygmomanometer or a blood pressure cuff. And we're going to see how you can do that. You can either buy one and do that at home, or you can go to one of the conveniently located blood pressure devices that you can find in many pharmacies or indeed in supermarkets. Let's see what we can find. So here we are at Rite Aid. Rite Aid is one of the choices that you have for measuring your blood pressure. Of course, you can go to your physician's office, get them to measure it, but that typically requires an appointment. It's not always easy to get appointments or to get there. Most people can make it to their pharmacy or to their local supermarket. Rite Aid is one of those examples. And in this particular instance, they have a Higgy device, which has some advantages because they capture the data. You can create an account and it will store it. And no matter which Higgy device you go to, you can keep that information and keep it in a single record. That's good news. Let's go and have a look. So here's the Higgy device installed. So it's very simple. There's not a lot to it. There's a seat. There's a blood pressure cuff. That's what we're going to be focusing on. And then there's also some additional things that you can do from screening, but we're not going to deal with those today. So the process of measuring your blood pressure is as easy as putting your arm in the cuff and then letting the machine do its work. It's as simple as that. And the good news is with this Higgy device, instead of just having to write down that result, if you create an account, you can store that, send it to the cloud. So the other option you have is to have a home-based blood pressure monitor. So here you can see a range of them. Lots of different variations from the inexpensive that are manually operated all the way to digital versions with cuffs and even fully automated ones that will take the recording and upload it to an account in the cloud so that you don't actually have to write it down. Either way, there's plenty of options available to measure your blood pressure. Okay, so now that you've got your blood pressure, what do you do about it? Well, we've got to know how that relates to the blood pressure recommendations, which have changed in the last several months, essentially lowering the guidance for when we think hypertension needs to be treated. 120/80 is the average, that's the normal. Just to be clear, average is not the same for everybody. Some people have lower, some people have higher, but essentially, if you have a blood pressure that's higher than 120 on the systolic or the higher number, or over 80 on the lower number or the diastolic, then you have something that we consider to be a treatable condition, or at least something that we need to pay attention to. So what should you do? Well, if you have anything over 120/80, you should go talk to your physician. Understand what that means in your particular instance, and then determine whether you need to have treatment, and if so, what that would entail. As for the guidelines, well, the guidelines changed such that the systolic number between 120 and 129, as long as your diastolic is remaining at 80, is considered to be early stages of hypertension and warrants investigation and potentially treatment. Anything that's over 129, so 130 and above, that's hypertension. Same with the lower number if that rises up to 90. And then if you go up above 180 on the systolic measure, then you have severe hypertension and certainly need to pay attention to that. The good news is, like all of these things from a screening perspective, it's better to find out earlier because we can do something about it. We can treat hypertension. Best form of treatment is exercise and also diet and making sure that you eat correctly and maintain an appropriate weight. But there are also medications that can help you in terms of reducing your hypertension. And we know that if we reduce your hypertension, then you're going to decrease the likelihood of developing cardiovascular disease and indeed stroke. So, incremental improvement. Make sure to measure your blood pressure on a regular basis. Go to a local store, supermarket, get one of the devices, and indeed go to your physician. And once you've done that, keep a track of it so that you can see whether that's going up, it's maintaining, and have the discussion with your physician to see if that's something that you need to treat. If I can ask a favor, if you like this video, please subscribe to the channel below. And if you didn't like it, leave me some comments. Let me know what I can do better next time. Otherwise, I'm Dr. Nick. I'm the Incrementalist. Don't let perfection stand in the way of progress.